America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. We're on, we think now, about 238 affiliates because we just added another one, KSYL AM and FM 104.9 in Alexandria, Louisiana. Very happy to have them on. Welcome them to America's Healthcare Advocate family. And David Gretchen, who was the manager there, brought us on the air. We're very happy, part of their broadcast, and happy to have them in the America's Healthcare Advocate family. KSYL AM and FM 104.9 on Saturday mornings. Very happy to be there. My producer behind the microphone, Mr. Darren Wilhite. Behind the camera is Dave Thiessen. All these shows are located on 15 podcast platforms. And we have our own YouTube channel. America's Healthcare Advocate is the YouTube channel. So all the shows are videotaped and posted up there. So if you want to tell somebody about a show, you can certainly do that. Now, I normally lead these shows off by telling you if you're looking for Medicare and you're chronologically challenged, like I am, you can reach out and just talk to the lovely Carolee Steele. Well, she happens to be here in studio today. So today you can actually watch her. And if you are looking for group health insurance, and if you're an employer or a human resource director, you can reach out to the lovely Maria Ahlers, who's sitting here in studio today as well. So we're glad to have them back in again.
Thanks for having us, Carrie.
We've got a lot to talk about today. So, again, if you want to reach out to them, by the way, the phone number there is 877-385-2224, anywhere in the country. They are happy to help you, 877-385-2224. Today, we're going to talk about Medicare. We're going to talk some changes in the marketplace here in the Kansas City metro. And you may be experiencing these in other parts of the country as well. So that's why we're making this a topic today, because people are getting notifications that in some markets, carriers are shifting out of Medicare Advantage. We're going to talk about that. We're also going to talk about what's new in Medicare. And then we're going to talk about, group health insurance plans and how RPSBBDI approaches this, their customer service program, how that works, and how it services your employees if you happen to be on one of the plans that they are the broker for, because they are they are insurance carrier agnostic. They do all the carriers all over the country, so they're licensed with all of them, appointed by them, and they can certainly bring you whatever product you may be interested in. So let's just start with what's going on in the marketplace, Carolee. There are some changes afoot.
Yes, there are. In the KC Metro, Blue KC, which a lot of their clients have already, and members have already received communication from them, they are actually pulling out of the Medicare Advantage market for 2025. Now, this does not affect any type of Medicare Supplement plan. They are still in place, intact, etc. However, and these plans they will be on will have full rich benefits all the way until December 31. So they'll have those until then. However, during the annual election period, which is October 15th, to December 7th, they will want to either look at Medicare supplements. And now people would say, well, I can't get onto that. I'd have to go through medical underwriting. But they do not have to do that because they're actually losing their plan. They have what's called guaranteed issue. That means they do not look at your medical history and all what's going on. They accept you guaranteed issue, which means that you would be accepted. That's an option for them to do. Obviously, Medicare supplements work completely different than Medicare Advantage plans. Medicare supplements, you're on one, you know that.
I'm on the Blue Cross Blue Shield plan, have been for the last, let's see, I'm 75. What is that, 13 years, something like that. Anyway.
Yes. So the Medicare supplement, does cost per month. Very rich benefits, et cetera, as long as they take Medicare, et cetera. So we can go over those options if they decide to pivot to do something on the Medicare supplement space.
All right, so let's go back because there's a lot in there. Let's unpack some of this stuff. So first of all, the first thing they need to understand is if you are on one of the Blue Cross and Blue Shield Medicare Advantage plans, you've received notification saying that the plan is not going to be renewed for the year 2025.
Correct.
However, all of the plans are in place through December 31st of this year. Am I correct?
Yes, sir. Yes, sir.
So nothing changes there.
Nothing.
Your providers don't change. Your out-of-pocket doesn't change. Costs don't change. Nothing changes. So rest easy. You know, we're only a month of June, July here, so we've got plenty of time as we move forward to deal with the issue. But the most important thing out of that piece that I think people need to hear is there's no need for panic.
Don't panic.
Because you've got coverage.
Everything will remain the same. It's going to be uninterrupted coverage on medical, your dental, your flex benefits. Everything that is in your plan right now will stay intact until December 31.
And all the providers are the same. No change in provider or anything. So you're good through December 31st. Here's another part that I think is key. They need, if people, I don't care whether, you're on a blue plan now and you're working with RPS, BBDI, or you're working somewhere else, you need to reach out and reach out to you and to the staff at RPS, BBDI and get a time set up just to understand what's going to happen. Maria's shaking your head. Yes, would you agree with that?
Yes, absolutely. I think now's the time to reach out, schedule an appointment, so that way it's done, it's taken care of. You will have to re-enroll, so now's the time to get on Carolee and the team schedule to even start just that preliminary scope of what you're looking for.
Yeah, and so here's what they've done at RPS BBDI. They've set up a separate email address for you to reach out to. So it's rpsmedicare at rpsbbdi.com, rpsmedicare at rpsbbdi.com. Or you can always call them. 913-385-2224. If you don't get them, if you call on a Saturday, whatever the case may be, there's a prompt on there, leave it, and they'll get right back to you, right?
Absolutely. And I've had some calls too where people go, well, I want to switch now. And you can't switch now because there is no special enrollment period. They're like, well, I want to move now. I don't want to wait they have to actually wait until October. So we are booking appointments. I said, I know it's in October, but it's going to be a little bit of a frenzy at that time.
A little bit? Yeah,
because it's going to be a feeding frenzy. And so I said, it's better to get on the books. We will get together. I will take we'll take good care of you. We'll make sure that you get into the right plan, whether you want to flip to supplement or, do something else. We can pivot and do it then, but we can't do anything. October 1st is when we can first have access to the benefits that are going to be offered for 2025 on Advantage plans.
Yeah, so let's kind of clarify that a little bit. So we won't know, RPS BBDI will not know what the new plans are going to look like, who's going to offer what until October 1st, right?
Correct. And that's when we have access to that information and that we can share it with the general public.
But Maria, you're saying for folks, get on the phone now.
Okay. Oh, yeah.
And get on the calendar. In previous years, when you're on the Medicare Advantage program, if you wanted to stay on it, it would just roll over. This year, you have to call to re-enroll and find a plan that works for you.
So if you're one of those folks on the Blue Cross plan, that is exactly what has to happen. And by the way, just so you know, you don't have to do an in-person appointment. They can do it over the phone. You can do it on a Zoom.
Everything. Mm-hmm.
Yeah, so you can do a Zoom conference, and they'll be happy to set it up for you. You don't have to do anything. Just click the button and go on and have a face-to-face meeting using the Zoom. It works really well. I do about 5 or 6 of those a day. Trust me, I know how they work. So that's a great way to interact if you don't want. But if you want to come to their offices on College Boulevard, 7800 College Boulevard.
6800.
Okay, see, I got it almost right.
Almost.
6800 College Boulevard. They're happy to have you come down and meet with them in person. Once again, the website, if you want to call them or reach out and schedule, is rpsmedicare at rpsbbdi.com. We'll be right back after the break, continue this conversation about Medicare and other topics. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Hang in there.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800. 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast here across the USA on the HIE Radio Network. You can find out more about us by going to the website americashealthcareadvocate.com, americashealthcareadvocate.com. So, again, the purpose of doing these kinds of shows is to educate you. That's why these are put up on the YouTube channel and they're on all the podcast channels, to educate you as to what is going on in the marketplace with the Medicare Advantage plans. Here in the Kansas City Metro, we have Blue Cross and Blue Shield pulling out of the Medicare Advantage market. You may be listening to this in Paducah, Kentucky. You may be listening to it in San Luis Obispo, California, where we're on the air, or you may be in Alexandria, Louisiana. This may be happening in your neck of the woods as well. You would have received a letter from the carrier advising you that it's happening. If it is, you can reach out to the folks at RPS BBDI. You can call them at 877-385-2224. That's 877-385-2224. They're happy to chat with you about other offers, other plan designs that are in the marketplace. Now is the time to get on the calendar. You heard Maria say it. Because let me tell you what's going to happen. Everybody's going to wait. They're going to procrastinate until October, November, and then all hell is going to break loose with people trying this. I've been through this before, and when carriers move out of the marketplace under ACA and other products, this is what happens. And if you wait, then trying to get through to somebody and get help is going to become that much more difficult. Also, you can go to the website rpsmedicare at rpsbbdi.com. Send them an email. They'll get you on the calendar, and they can start talking to you about, hey, let's set something up. We'll start talking in August, September, and then you'll feel like you know where you're going to go. So let's talk a little bit about that and the fact that you get the carrier information about the 1st of October.
1st of October is when we can actually disclose benefits, et cetera, from each of the carriers that have a Medicare Advantage plan for 2025. So that's when we are able to actually have a great discussion with them. Right now, we are just putting them on the calendar so that there's no surprises for them and they're not, lost. So they're on the calendar. We will have a phone call. We can have a Teams invite. We can see face to face. We can go through, or in person. We can do whichever one that they feel most comfortable about. The move from the Blue Cross Medicare Advantage plan has to be consumer initiated. As far as we as a broker, we can reach out to our people. But as far as them, nobody's going to flip you over to another carrier. That has to be done with a broker, and they have to go to a lot of the carriers.
Yeah, and here's something I'm going to we see this happen often. Don't go do this yourself. I'm just going to tell you flat out, it's a mistake. Okay, we did a show with a young lady here who did this on an ACA plan, got pregnant, and went back in to report the fact that she had filed it under her married name. They wanted it under her maiden name. She went back to do that, and she wound up losing her coverage. This is through the government website and through the government care guides that were handling this. And we did a whole radio show on her. She also did some television here, and she lost her coverage. And it was a nightmare getting it back. I'm just telling you, don't go up there and try to figure this out on your own, because it's complicated and it's difficult.
It is, and there's so many moving parts to Medicare, and everyone's situation is completely different. They go, well, what's the best of the thing? It depends on what is your non-negotiables. Your doctors, are they in the network? The medications, et cetera. Do you need more dental than you need something else? So we take a look at the situation, the life situation that they're in, and then we can look to see what's across the horizon for all of 2025 Medicare space and figure out what's best for them.
Maria, what I've found in the past is when people went out and did this on Medicare Advantage, where they signed up and then they call you a month later and go, oh my God, I got in this thing and I didn't realize they don't cover my prescription drug.
That's right. Carrie, I work for RPS, and my parents see Carolee. I don't try to diagnose or figure out which plan works best for them because they are the experts. There's so many moving parts to determining what is the right coverage for you and what, medical benefits. It affects your pocketbook. And so we really want to make sure that we're helping you out, not just about the plan, but also on the financial side to make sure that you can afford the coverage. Or if we can find you some subsidies, we'll do that too.
And just because and that's a great point you bring up on the financial side, just because that premium is zero premium from another carrier, that doesn't mean it's an identical plan, right?
Absolutely, because everything is going to be changing next year. That's why October 1st, we will go over all of the Medicare Advantage plan options that are available to them, figure out which is best. It's not a one-size-fits-all. No. Absolutely not. It's not, because everyone has different needs and different, as far as like I said, providers, drugs, all the flex benefits, So we look to see what the other carriers are going to be bringing to the table on Medicare Advantage, or if a better fit for them is to pivot off that Blue Cross Medicare Advantage plan and go to a Medicare Supplement.
And so the other side to that is that you don't know what you don't know.
Right.
You're the consumer. You think, well, it looks just like the one I had before. You may not know that your doctor or hospital, they all have different networks.
And they don't know the questions to ask. And so that's where we are, so that we actually do kind of a discovery process with them, and we ask the questions, over time and figure out their situation and which plan works best for them.
And I will tell you, do not call one of these phone numbers, because you're going to see hundreds of these ads done by various celebrities, whether it's William Devane or the former governor of Arkansas, telling you to call this number for a Medicare, for Medicare evaluation. If I had a nickel for every call that I get, marketing call from a senior care consultant, quote unquote, from one of these call centers, I'd have enough money to fill a piggy bank. Okay, so I'm telling you, those people do not understand your network in your town. Here's you want to do a quiz? Ask them to tell you, hey, are the hospitals north of the river in the plan? And then ask them which hospital. They're not going to know what you're talking about. They go, what river?
What river?
Yeah.
That's what I always say.
Yeah. So, that's just an example of what goes on. That's why you talk to somebody here that understands what's going on and can help you with that and walk you through it so that you're getting what you need in a timely manner.
Right. And it could be another Medicare Advantage plan. It could be a Medicare Supplement plan. Supplements only cover medical. And so you would have to then go to get some type of drug plan. So that's where we come into play, is that we will make sure that you have everything you need to cover your healthcare needs.
Yeah, and that also includes if there's vision and dental on this plan, that may not be on the next plan you go to enroll in, correct?
Correct. And that's where we come into play, is that we will look to see and we will fit your life situation with the certain Medicare Advantage Med Supplement plan, going forward.
And again, maybe they'll be offered, but you could be a different amount of money for dental and a different amount of money for, you're not going to know that stuff unless you sit down and talk to somebody.
Not until October 1st. That's why we have to set up, meetings for October, because we cannot really disclose anything now because we don't have that information. So that's why we wait till October.
And if anybody tells you that's incorrect, okay?
Correct.
Just to be really clear and be really honest about this. And if they try to move you now, they can't move you because you're still in the lockdown period until we get to open enrollment, which begins on October 15th. So once again, if you need help, you can call 877-385-2224. I don't care where you're at in the country. And if you're here in Kansas City Metro, obviously RPS benefits by design, or you can go to their website, rpsmedicare at rpsbbdi.com, rpsmedicare at rpsbbdi.com. We'll be right back after the break. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIE Radio Network. If you want to find out more about us, go to the website, americashealthcareadvocate.com. That's americashealthcareadvocate.com. Shows are posted up there. If you want to send me an email, feel free to do that. If there's a question, something I can help you with, I get people from all over the country. Oftentimes will send me an email, need help with some type of an issue regarding insurance or otherwise. We are happy to do so. If you've got a topic you would like us to discuss or talk about, or maybe you want to be a guest on the show, if you're a medical professional or someone associated with healthcare, we'd be happy to chat with you. Once again, the website, americashealthcareadvocate.com. In studio with me today is Carolee Steele from RPS Benefits by Design and Chief Operating Officer Maria Ahlers here talking about what's going on in the marketplace for Medicare. And now we're going to switch gears and talk about what's going on in the marketplace with group health insurance benefits, how those are changing, what we're going to see in changes coming up. Also, quick note, by the way, RPS BBDI is licensed throughout the country nationally. So I don't care where you're at. I said if you're in Paducah, Kentucky, or you're in Tupelo, Mississippi, or you happen to be right here in Kansas somewhere, feel free to reach out and give them a call. The number is 877-385-2224. They can help you with just about any insurance needs you have, 877-385-2224. That email, if you are interested in help with Medicare, is rpsmedicare at rpsbbdi.com. All right, let's switch gears a little bit. Let's talk about what's going on in the marketplace with regard to group health insurance and especially for small employers, Maria, this is a real challenge today.
It is. They meet a lot of challenges in getting that premium to where it's affordable. So we're helping our clients to navigate through those challenges that the market is just bringing on.
Yeah, and it's particularly challenged for small employers when they're trying to pay a portion of that for the employee, but where it really falls off a cliff typically is when it comes to that employee trying to put their family on a plan. How do you all deal with that and help them if the employer's got a plan, but the family rate is just more than they can afford?
Well, we're fortunate enough to work with different carriers and different carve-out option plans to help with that cost. A lot of it is employee education, Carrie, is sitting down with the employees and figuring out if they really need a certain plan. Sometimes moving up in a higher deductible because they're a healthy family helps reduce that cost as well. So really just getting to know the employee and knowing what they need for their coverage is where everything starts.
So that's interesting. So, a lot of brokers in that situation can say, well, this is what they're offering and we're not really equipped to deal with you on let's say they want to go to an individual plan for the family. For the wife or for the husband and kids, whatever. Oftentimes, one of the illustrations that I think it's really good is school district plans. Mm-hmm. They're great benefit plans for the teachers. Right. They're not so great when it comes to, they're great for the employees, families, if they can afford it. Right. But I remember back, when teachers would come to us from Olathe School District, from different school districts, and the plans were just, the cost was beyond their ability to pay. You're talking $1,400, $1,500, $1,600, sometimes $2,000 a month. But if they move to an individual plan, mm-hmm. then you can drop that cost significantly. You might even qualify for a decent subsidy.
That's right. We look at their family their family structure. Sometimes it is more affordable to have one spouse on an individual plan and the other spouse takes the kids. Or it's more affordable for each of them to have their own plans with their own employers. So really we're looking at what the whole picture to determine what's their best options are. We don't just look at what their employer offers, but let's talk about your spouse or your significant other and what are they offering? Are they covering what your plus one, your spouse, your significant other needs, and what makes sense on who should cover the kids? Or does it make sense for both of you to be on your husband's plan or the wife's plan? And then we have other carve-out options too. One of the things we always hear from our clients is, I get emails all the time, Maria, I need my premiums to be lower for my employees. And I agree. I would love to do that. But as we all know, our insurance costs is just continuing to grow up. And with that, we need to do a lot of employee education.
And so, that's what an example that I just gave. The broker that writes those large group plans is typically not going to be a broker that does individual health insurance. Now, RPS BBDI has always been a broker that services the large group, small group, and the individual market. And so if you're faced with that, I don't care where you're at in the country, like I keep referencing Paducah, Kentucky for some reason today. Maybe it's because we're on the radio down there, but or whether it's Cape Girardeau, Missouri, or whether it's San Luis Obispo, California, if you're up against that, you're not going to be able to talk to that broker at that agency because they only deal with large group plans. They're not going to deal with individual health insurance. That's where RPS Benefits by Design can make a difference, right?
Absolutely. I hate to use the cliche, but we are a one-stop shop. If we realize that your spouse is aging into Medicare, we have specialists for that. If you have a child that's aging off of your plan, we have specialists for that. We really can help in any situations. We can, if you're a 1099, which a lot of carriers don't cover, we have an option for that. We really try to be creative in our approach to make sure that we have something that is a fit for everyone.
Yeah. So an example would be, let's say that and your employer, your coverage is paid for by the employer, or he's paying 50% of it, 75% of it, and the rest of it you can afford to pay for that. But let's say your husband is an Uber driver, okay, or your wife is an Uber driver. They're a 1099 employee.
Yep.
The carriers aren't offering coverage for that. We have RPS Benefits by Design has a plan for that. It's specifically for people that are 1099. Most brokers around the country don't even know those plans exist, and certainly aren't able to get people enrolled in them. So again, it's being able to serve all segments of the marketplace and do it in a way that really makes a difference.
It really does. And having everything housed in one place makes it easy. If you know you're aging into Medicare, well, I'm going to call RPS. Well, my son just graduated, is turning 26. I'm going to call RPS. They are able to help us. We have specialists in, different market groups, the small market, the large market, even on the group side, because each of it requires different regulations, different compliance, different plans, different carriers. And so our goal is to find one that works for the employees. There's no point in offering plans if the employees can't afford it.
Yeah, and unfortunately in today's world, we're seeing a lot of that.
We are.
Yeah, and so again, I reiterate, if you've got a situation like that, maybe you're not getting any help, or maybe that's not something that your particular broker in your case does. The folks at RPS BBDI will help you. They're happy to help you any place in the country. They do. In fact, on the way up here to do the show, you were talking about a client who had called you.
Yes.
And so people call in off this radio show all the time.
All the time. And we love it. We love it.
Well, and I'm going to piggyback really quick on what you said about the employee is very affordable, but the spouse was not. One person, she's like, well, he doesn't need to go to Medicare because he's on my plan. I said, well, find out how much of that premium is his and how much is yours. And she's like, all of it's his. So he ended up moving to Medicare because the employee was covered very well.
Yeah, and see, a lot of people don't realize that. Yeah. Okay, that's a classic example of paying for something and not knowing what you're paying for. Well, that might be a good time to pick up the phone and give them a call and just ask those questions, because if the employer in this case was paying for all of her premium, but none of the husband's, and she moved to a Medicare Advantage?
It moved to a Medicare plan, and it
zero
saved
premium?
And it really saved him quite a bit. Well, they didn't know that, she didn't know that most of the cost for her premium that was coming out of her check was for her spouse. So when her spouse turned Medicare eligible, then, she moved. At first, she was like, I'll just keep him on my plan. But she knew that it was much more financial and their healthcare needs were covered well.
And on the employer side, that's why we work so well together with the Medicare team, is we can look and see who has a spouse that's aging off of Medicare that we can maybe put on a Medicare program versus being on the employer plan. The benefits may be more rich on a Medicare plan than on the employer plan.
Well, yeah, because the Medicare Advantage plan, you don't have a premium. Right. On most of these plans, it's zero premium plans now. So right out of the gate, you don't have a premium. If this sounds complicated, that's because it is. Which is why I'd say to you, don't try to do these things on your own. I talked about this in the opening segment here. I talked about it in the last segment. Don't make the mistake of trying to go up online and do this yourself and figure that you got it figured out, because 9 times out of 10, you're going to find out that there's some piece of that that's not going to work the way you think it does. Also, please stay away from these call centers that you get on that are calling every day if you're over 65, or these advertisements you're seeing on YouTube and on the television. They are not the best source for you to go to get the kind of coverage you need. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Stay right there. We'll be back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer is Mr. Darren Wilhite, behind the microphones on the Odyssey Studios here, and behind the camera, Mr. Dave Beeson, who records all these, edits all these, and puts them up on the YouTube channels. They are up there. So, if you want to share this with a group of friends about what's going on in the marketplace right now with Blue Cross or some of the other issues that are out there, the YouTube channel is up there. You can certainly do that by telling folks to go there, or even one of the podcast channels, iHeartRadio, Odyssey Radio, Spotify, SoundCloud. We're on 15 of them. So you can certainly find us up on your favorite podcast channel, and obviously listening to us across the country. As we said earlier, we just have a newest station. We just keep adding stations. We added the newest one in Alexandria, Louisiana. Very happy to have those folks on. So let's change gears a little bit. We're talking about group here. One of the things that happens every year, Maria, is employers have a tendency to wait. Also, some brokers aren't real proactive about getting those new rates out to the client. And, I hesitate to paint this brush on all the brokers, but there are certain brokers that do this, that they'll delay those rates on purpose so it becomes more difficult for people to change. I'm suggesting that, if there are going to be increases next year.
That's
period.
Right. Yep.
Okay. They might be 6% if you're really lucky, more like 10, 12, 15. And if you're not lucky, they could be as high as 23%. It depends on what you're on. Okay, and if you're on an ACA plan, or you're on a level premium plan, I remember getting level premium renewals that were 120%, simply because the carrier wanted to push them off the plan. So it happens all the time.
It does. It happens all the time. What we do to be proactive is we work on renewals 120 days out. So we're looking at October right now, getting with our clients to discuss pain points. Are the plans working? Looking at utilization and claims, so then we can forecast what the renewals may come in at. Most carriers really don't release renewal rates until 60 days out. Sometimes we get lucky at 90 days out, which then we're really in a tight time frame to get everything done, because you're talking about going to get quotes, which all the carriers are working on it. So anything that usually takes 5 to 7 days is now taking 7 to 14 days. And then we got to get employees enrolled. And if we're going to go to different carriers, complete all the paperwork. And then we have a benefits platform where all our clients' employees can enroll on this benefits platform. Makes it really nice and smooth. I had a client, their renewal is August 1st. And historically, their renewals have been in the teens, like you mentioned, 15 to 20%. And this year, we actually went to market and found them a plan that is 7% less than the renewal.
I bet they were thrilled. That's not a story you hear every day.
No.
Yeah, you usually don't get a decrease. But we, and this client was with another broker for many, many years. And that broker just did the same thing, renewed with the same carrier. And they had reached out to me through a mutual networking professional. And we went out and went to market and got a 7% decrease for them.
That's funny. That brings to mind a story that happened to me in Carterville, Illinois, where the city was paying for a policy. We had their health insurance. They were paying for a life insurance policy, and we asked them who was handling the life insurance policy because they were paying a ridiculous price for this policy, which happened to, by the way, include the city council. And they said, "Well, the broker 3 doors down. We think it's him. We're not sure." I said, "Well, who's getting the premium check? Who's getting the commission check on it?" It turned out it was a completely different broker. They had no idea who was covering them. So this happens. Okay, people get complacent. And what you're hearing is you shouldn't. Okay, because Maria, they reached out to Maria, they were able to affect a 7% decrease. Not all brokers are Johnny on the spot and proactive about these things, and that's one of the things that's different along with customer service. As we wrap this up today at RPSBBDI, talk briefly about your customer service, because they're never going to tell you to call the carrier.
No, we'll never tell you to call the carrier. You have a direct line, and as Carrie famously says, it's not a 1-800 I don't give a damn. It's direct line to a account manager, and that account manager takes care of everything for you. The beauty of it is each account manager specializes in the market of the size of the employer. Again, each employer requires, depending on your size, you can only offer certain plans, and there's a lot of compliance issues. But we pride ourselves. We know that insurance makes an impact on employees.
Makes an impact on the employers being able to keep their employees and recruit
That's right.
new
Recruit
employees.
And retention. It's one of the biggest costs besides payroll is benefits. So we want to do everything we can to help people out. We love hearing the stories of, I couldn't get this covered before and someone made a call and we got it covered. You're at the pharmacy place. Well, they can't find my ID card. Give us a call. We'll pull it up. Text it to you, email it to you, talk to your pharmacist, whatever we need to do to help you to navigate through this thing called healthcare life.
I like that term. I haven't heard that before. That's pretty good. Healthcare life. That's or for the life of the healthcare.
Yep, that's
there
right.
You go.
There you
go. It's just I'm sure I could ask Carolee to sit here and recite story after story about customers that have called you where you're, especially on the Medicare side, where people get nervous and concerned.
And it's so wonderful to have an agent of record, because we can go to bat for you. We can figure out, if we don't know, we can figure out who it is, instead of just being, you've got a Medicare Advantage plan written, you don't remember who the broker was, and you have no idea. If there's an issue that comes up, you need a pre-authorization for a surgery, you need something, we are able to navigate that as the agent of record. We can go and do that on their behalf with their assistance, obviously, and get those things done.
Yeah, and it makes a big difference for folks.
It does.
So again, the purpose of the show is educational to bring you up to speed on what's going on in the marketplace on the Medicare side. The same thing on the group side. I don't care how big your group is, if it's 5 lives or 500 lives. If you reach out and call Maria at 877-385-2224, they will connect with you and they will evaluate. Maybe they're going to tell you what you've got is great. There's no need for you to think about changing. On the other hand, you may find out like this. Like the employer who reached out to them on a plan they've been on for a lot of years because the broker chose not to move them or give them anything that was any better. They saved 7% of their premium. They were probably pretty happy about that. That takes work. That takes effort. You've got to be willing to do it. They're willing to do it. They will not tell you to call the carrier 1-800 I don't give a damn number. You're absolutely correct about that. But you can call 877-385-2224. They're happy to chat with you anywhere in the country, 877-385-2224. If you are chronologically challenged and you do have issues with Medicare, rpsmedicare at rpsbbdi.com. Thank you for listening today, and now I leave you with this thought from Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.